Most people know that stress has a powerful impact on their mental health. But did you know that stress can also significantly affect your physical health, especially your menstrual cycle? So hello and welcome back to hashtag Ask Dr. Namrata, and today we'll be discussing about the effect of stress on your menstrual cycle. Let's understand how stress can mess up with your period. Here are some changes that you'd notice. There can either be a delayed period or an early period, a missed period or a very painful period, or altogether a very worst PMS or premenstrual syndrome. Let's understand why does this happen. These changes could be caused because of an emotional or a physical stress, or either due to both of them. It could be that you haven't slept enough or you haven't eaten enough, or that you are physically exhausted, fatigued, worried or overwhelmed. These cause changes in the brain's chemistry of yours, as a result of which there are changes in your menstrual cycle. When you are stressed, your body makes hormone called cortisol. High levels of cortisol affects the hypothalamus to stop ovulation tracts. Hypothalamus is a part of the brain which controls your menstrual cycle. Since ovulation is the key to having a menstrual cycle, this can affect when your cycle starts. We do not know why, but everyone reacts to stress differently. Some people may experience changes earlier in their menstrual cycle, whereas for others the changes may kick in late, and for other set of people they may absolutely not experience any changes in their menstrual cycle. Some people are more sensitive to stress than the others, and it is difficult to predict whether short-term, long-term, moderate or severe stress has got a change in their cycle. But we know one fact for sure, that people with anxiety and depression do get affected by stress. And so what can you do if stress is impacting your cycle? See, stress is something that is inevitable. So instead of escaping stress, or instead of trying to control your environment and people around you, I think we all must learn to manage our stress levels and our responses to stress. There are certain techniques, however, which you can definitely follow, which can help you reduce your stress levels. The first is breathing technique. Try doing some calm and deep breaths whenever you are in stress. Breathe in through your nose and let the breath reach till the pit of your stomach. Try counting 5 and reverse till you are feeling comfortable enough. You can do this at any place you are seated in. Next technique is mindfulness meditation. This technique is all about being present at and in the very moment. You can practice this from wherever you are. The next you can do is try doing some stretching or some exercises regularly whenever you feel stressed. You could also avoid smoking, alcoholic or any drug substances if you are abusing your body with one of them. Also, you can follow a regular sleeping schedule. This immensely helps in regulating your menstrual cycles. And you can try eating fresh leafy vegetables, fresh fruits, and trying to incorporate a healthy diet. And see a counselor or a therapist that can just help you talk out things. And yet, if your cycle is not returning back to normal, I feel that you must talk to your physician about it for sure. We've now understood how stress impacts our menstrual cycle. But besides our periods, there are other areas where stress can definitely cause serious health conditions. Say it can bring up a pre-diabetic state, an obesity state, also blood pressure early in people who stress or fret easily. Hence, it is very important for us to manage stress. What is the homeopathic approach towards irregular menstrual cycles that have been affected by stress? In my practice, I try to find out what are the stressors or triggerers that has caused this kind of irregularity in the menstrual cycle, or what are the triggerers that are bringing up a very difficult dysmenorrhea or painful cycle. By finding this out, a constitutional remedy is prescribed. I use a lot of remedies like Bovista, Sepia, Natromure, Pulsatilla, Calcarea carb, Lachesis in my clinical practice, majorly for irregularities in menstrual cycle, and there are many more that can be listed, but these I mentioned for the sake of my fellow homeopathic students so that they can refer these remedies, and they were just clinical tips. None of the patients or none of the viewers who are watching this video are supposed to buy these remedies on their own, because homeopathic prescriptions are quite individualized and none of them may have an effect over you if you buy them and do self-medication. I hope this information was resourceful to you, and up till my next video, stay healthy and stay fit.